Hello, I'm Dr. Seema Rao. Good afternoon, sir.
Good
And
afternoon.
yeah, so what made you think about sharing your experiences in this interview today?
Yes, Seema, thank you very much for having agreed to my request. As you know, both of us are doing the spirituality course of the Chinmaya International Foundation. And as a part of the class that Krishji is taking, he had invited people to share some of the events or episodes which were painful
Hmm,
to an individual.
hmm,
And I did email him, and he said that he would be happy for me to share that probably in the next class. Then this idea occurred to me that why not I sit with you in a kind of an interview
hmm.
whereby I would probably be able to share things a little better. And perhaps you might assist me in sharing it by posing appropriate questions at that point of time. So, all yours, and let's hope that this works. And if it does, then uh, I would like to share it with Krishji, and if he thinks it appropriate, to share it with the rest of the class.
Thank you so much, sir. It takes a lot of courage to come out and speak in this manner about your personal experiences.
Thank you.
So, would you like to tell us how did this all start and what happened, the course, how it went
Right.
through?
So I still remember the day when, out of curiosity, I took a strip, which checks urine,
Hmm,
diagnostic
hmm,
strip
hmm,
with sugar and
hmm,
all that
hmm.
stuff. And to my horror, I found that it was positive for proteins.
Okay.
And then I said, what is it all
Hmm,
about? And I did check the protein, regular routine urine test, and I found that it was positive. So I was about 40 at that time. So it was a good 8, 9 years probably before the event happened. And so I realized that, something is going to happen, but I didn't tell anybody. And I used to get my serum creatinine checked at random. I'd go to the lab and say, hey, just take my sample and check for creatinine. And it always used to be normal. Then I remember I was heading to the UK to attend the initial contact sessions of the diploma
hmm,
palliative medicine
hmm,
at Cardiff
hmm.
itself. And I went to the hospital in Malleshwaram where I used to go, and I gave a sample. And the technician called me in the afternoon and said that, sir, your creatinine is, gone up to 2.2. And I knew that the fuse was lit, but I didn't bother to tell anybody. I came back after about 6 weeks, and then I talked to my nephrologist, and then they decided to that I should get an MRI scan done. I didn't tell anybody. I didn't tell Jayashree, my wife. I hardly finished the MRI scan and came to my room, and all hell broke loose because somebody saw me in the MRI room and immediately called up Jayashree. She was in the operating room and then said, "What's Nagesh doing here?" And she came charging. Of course, she went to the MRI room to find out what's happening. And then she just looked at me and says, "So, you've been lying to me." Obviously, you wouldn't like to tell. Anyway, to cut a long story short, it was very clear that, I had chronic renal failure and that I needed to ultimately have a renal transplant. They call that as renal replacement therapy.
Hmm,
Very
hmm,
sophisticated word,
hmm.
probably to make the impact
Yeah.
less. So there were a lot of things that needed to be done: lose weight, keep your blood pressure under control, keep your cholesterol under control. Everything went fine. And then they decided to do what is known as a preemptive transplant.
Thank you for sharing that experience, sir. Before we move on to that preemptive transplant and your experience with that, I just wanted to ask you one question. You told me you didn't tell anybody, not your wife, or you didn't disclose about all this to anybody. So, what was the barrier there? Why did you not tell anybody or share this with anyone?
Uh, I suppose, I thought that let me find out what is happening and then and tell her. But I knew that I had to at some point of time, and it's not something that you can really hide. I certainly was not in any stage of denial or anything, because being a medical person myself, I knew what it was. But I thought, let me, anyway, she's going to get worried and concerned and whatever. If I could delay that by, I don't know, a few days, but I got caught very badly. Total security leak in the hospital, because everybody knew me that well. So I think that was the reason.
So primarily it was a sense of wanting to protect your loved one, maybe
Yes,
from
yeah,
the anxiety that
yes,
comes
yes.
from this.
That exactly, I think, is the right
Yeah.
word to use.
Yeah.
Yeah.
So,
Yeah.
so then how did you feel, or how did you deal with this, progression of the failure and the need for transplant, all this?
Of course, I was. This proteinuria was going on for a long time, so this obviously did not come as a sudden sort of shock. We hope, that okay, it's going to happen, but it's going to happen, long time away, and when it really did happen, it obviously hits you. Of course, because of the fact that I knew what renal failure was, I did realize that it was going to be a long haul. And when I did discuss with my nephrologist, who was also a very close friend of mine, he did tell me that there was, light at the end of the tunnel, in the sense that transplant would be very much possible. And I was also aware that my wife and I have the same blood group, so there was a good possibility that it will happen. But yes, it was concerning, and the worst part of it is that what's going to happen in future. It's totally dark, bleak. But I really don't know. I mean, it's more than 20 years this story happened, but even in my worst sort of situation, I thought that perhaps, I don't know whether it was fatalistic attitude that it's happened. So I need to deal with it. And I think to a certain extent also I was influenced by the general attitude that my wife was taking, not about my renal failure, but in general about life. And that is, when she was very young, 13, 14 maybe, uh, she had undergone what we among the Vaishnavites say is bharanyasa, which, unlike sannyasa, where you give up the worldly pleasures, bharanyasa is where you hand over all your problems, so to say, to the Almighty, and trust Him implicitly, and say that it's all in your hands, and as human beings we do whatever we need to do. I think to a very large extent I was influenced by that, perhaps reflexively, having listened to her speaking about it so many times, and that was always my attitude, that whatever it is, and let me face it. And of course, I got enormous amount of support from my wife, and of course, a lot of my friends. But I think my parents were very, very devastated. My father, of course, became very silent, and more than my father, my mother went into a shell. She generally did not want to meet people, and so we thought that the first transplant would answer all the questions, so to say. And they said preemptive, which meant that I underwent only 2 or 3 sessions of dialysis. Of course, I needed to have a small minor surgical procedure, what they call as a AV fistula. And I used to joke with people, because the moment you touch that, you could feel a thrill, that because of the hyperdynamic circulation. So I used to joke with my nephrologist. I'd say I'm a thrilling person now, And so the preemptive transplant was done.
Mm.
My wife, of course, was the donor, and uh, within a matter of a couple of hours, the urine output reduced to almost nothing.
Mm.
Normally, post-transplant, the first 24 hours or even 48 hours, a patient will be passing something like 20 to 25 liters of urine in 24 hours. And so the urine output came down, and then, of course, they did all kinds of things. They gave me some thing for rejection, and I could make out that my treating team was very, very distressed by what had happened to me. And they were not talking about it. They were not communicating to me what was really happening. And every time I'd be reassured. In fact, I can never forget the nurse in charge of the ward, a very good friend of mine, Sister Euphrasia. She would keep on saying, Simaji, don't worry, so many patients have been revived, blah, blah. They went on. But I could make out from their face. And I can never forget, the nursing director, the principal of the nursing school. I could see on their face they were devastated. But I kind of said, okay, let me see what happens. And then they decided finally to do a nuclear medicine scan to see what was happening. Because, and the nuclear medicine physician told me, sir, please go and sit in the nephrologist's room. I could make out from her face that. So the body language that was being shown by my treating team, I knew that there was something majorly wrong. And then the diagnosis was that the graft had got thrombosed, which is a very, very rare complication. And it is not a rejection reaction. It's basically a technical error. And then so they explored me a few days later, and my wife's kidney, her gift to me was, of course, it was thrown into the dustbin, but not directly into the dustbin, via the pathology department, so that they could have a look at whatever it was going to be. And so that was the end of the story. There were a lot of things that happened during that time. I obviously was fluid overloaded. I needed to have emergency dialysis. I was breathless. I was left alone in a room when people were waiting to come. All alone. There was nobody in the room. Okay. And however much you are as a doctor, but everybody's disappeared, right? Perhaps I would like to sit and talk to my medical team, but then I said, it's all right, they're very close friends of mine. That was very, very difficult. And I realized that that was the end of the story, as far as the first transplant was concerned. In the midst of all this, in a kind of a philosophical way, so to say, a very, very eminent neurosurgeon who was the godfather to both Jayashree and I, Dr. R.M. Verma, very famous neurosurgeon. He came and saw me, and he said, son, I can understand what's happening, but you do understand that whatever comes out of chaos is always of a much higher quality. My wife realized that her gift to me was going to be thrown into the dustbin in a few days' time. So she wanted to reassure me, but she had been operated donor nephrectomy. That also, it was not laparoscopic, it was an open, a long flank incision. So she was brought in a wheelchair to my room, and she was very philosophical. She said, well, that's the way it is, that's the way it is. And sometime later, I asked her, I said, tell me, okay, you decided to donate to me, okay, I'm your husband and all this stuff, but it was thrown into the dustbin. Why did this happen? So she gave me a very, very, I don't know what word to use, explanation. She said, you trust the universe. I said, what do you mean by trust the universe? She said, your kidney's in the dustbin. So her family is a very strong history of malignancy. A lot of people in her family had, including her mother, her grandparents, and so on and so forth. So how do you know this kidney might have been destined to become malignant? And the universe wanted to make sure that it was not in me, and it was also not in you. So I raised my hand and I told her, I'm not going to, I'm not going to even talk about it because there's no logic according to me. But that's the story. That's the way it is.
Mm-hmm.
So yes, then I had to undergo, 6 months of dialysis. My very thrilling AV fistula, because of the hypertension on the table, got blocked. So I had to undergo an AV graft and all that stuff. Which is another story. And then I had 6 months of dialysis, and then with a lot of tamasha that happened in between, and then I had a second transplant. Second transplant lasted for about 5 years because I had multiple subclinical rejection reactions, and ultimately I was ready to go for the third transplant. And in between, with all this tamasha, just to add a little more, it's like in a movie, you have a comedian coming in, you have a villain coming in. So when I thought that everything had settled after the second transplant, I was walking, and I noticed that there was a lot of pain. So then I realized that I had avascular necrosis, and I needed to have ultimately hip replacement. Because they did a minor, I won't say minor, but a short surgical procedure called core decompression, where they drill multiple holes. So 45-minute surgery and 6 weeks non-weight bearing on either side, and it became impossible to manage that. And so I decided, told my orthopedic surgeon that no, this is not going to work, and so they decided to do bilateral hip replacement. And there's humor in life, and the orthopedic surgeon, again a mentor of mine, said that there's an Italian surgeon who's a friend of his, and he is expert in surface replacement, which they wanted to try. So at the end of the whole thing, I said, excuse me, sir, but by the way, what is this surgeon's name? So he replied, Marega. And then he said, no, his name is Marega, Luca Marega, his surname is Marega. And so I used to joke, oh, Marega mein jiyega. And I had bilateral hip replacement. And finally, the second transplant lasted for about 5 years, gradual deterioration. And then my nephrologist called me again and said, so Nagesh, basically, we need to go in for another transplant. So you have two choices, very proper, excellent communication. He said, if you would like to continue with dialysis, you can continue for the rest of your life or whatever. But I have a feeling that the third transplant will work. I don't know on what basis he said that. So I told him, and there was this transplant nurse who was standing next to him. I said, look, my friend, if you insist that I should go on dialysis, I would rather jump into the Alsur lake. So he smiled and said, Nagesh, that's of no use because there's not enough water for you to drown. And the water is so filthy, you will get severe diarrhea. And we laughed. I come out and that transplant nurse is waiting outside. Again, very good friend of mine. She holds my hand almost in tears and says, sir, I hope you're not planning to do anything. I said, come on, for heaven's sake, it's not like that, So anyway, the third transplant, by the grace of God, worked. So that's the medical aspect of the whole thing. I mean, a lot of things that happen in between. And one of the things that I thought that I should mention is that a very close friend of mine, a pathologist friend of mine, I told him this was, my second transplant had a major leak. Okay. And so after 3-4 months of the, sinus leaking, and I used to go to work with diapers so that, because the leak was there. So then they realized that the leak was coming from the second transplanted kidney because of, again, I don't want to go into the details because it'll take a whole 1 hour. So I said, I want a book to read. And I was here lying in the hospital with a catheter and a drain for almost 7 weeks. So he asked me to said, would you like to read? I said, I don't like novels, get me something to read. So he gave me this book to read, Light from Many
Light from
Lamps,
many
which I've
lamps.
talked about so much. And I was reading about that, and then there was this one of the stories which was titled "This Too Shall Pass,"
Mm.
and a poet like you would appreciate that poem by Jonathan Hayne, which kind of. So I realized that this too shall pass. Either I'll get well or I'll go, whatever it might be. And so I asked my son, who second son was still young, to type this on a paper, and I stuck it outside my door. And I insisted on my nephrologist and my urologist. Uh, Nephrologist was coping well. Urologist was not coping that well with my illness. He had to read that every day before he entered my room. And I still remember one day I had severe rigors and I was shaking like that. And my nurse friend, Sister Euphrasia, no, Euphrasia, her name is, she was panicking and she said, Simaji, don't worry. She put a blanket on me and I knew it was the rigor to go. I was shivering and I said, Mary, you want to know something? Yes, Simaji, yes, Simaji. So this too shall pass away. She got so mad with me. And I used to wonder and say, look, you guys, you're getting unnecessarily upset with me. Why? Then I realized that they were getting upset with me for not getting upset with them because I was not reacting. They offered me second opinion for something. And then I told my nephrologist, I said, stop using such unparliamentary language with me. Do you want to go somewhere? You want to take a second opinion? He says, I know you guys for years. My wife has been part of the transplant team. Whatever happens to me is going to be happening here. So I think I caused a lot of pain and suffering to my colleagues. But that was it.
It's been actually a very tumultuous journey, ups and downs constantly. But throughout this, I am looking at one thing, that is the faith that you have. Whether it is faith in the Almighty, what you said, you left everything to destiny. Whatever has to happen, happen. I mean, it's debatable whether it is a fatalistic view or the right, it's debatable. But there was faith there. And that implicit faith that you had on the doctors that who were
Yes,
treating you,
yes.
despite, and throughout there is one thread that I am seeing is that of trust and faith. And I think the social support that you looked and received,
Phenomenal.
and probably your sense of humor, as I keep telling you, these are the four things that actually have come out from you've spoken about so much of suffering also along with it. So were there any moment in this journey where you questioned your faith, that either in the doctors or in the Almighty, or
Never, never, never. I also realized, in my journey as a surgeon and whatever, I used to always tell my patients that, unless you trust, I mean, you be careful before you trust anybody. I'm not saying just go and trust anybody, but you do your homework, and once you trust, I used to tell my patients, I will give you a better result as a surgeon. Intentions are very honorable. It's the same skill, or the same lack of competence, or whatever, Peter's principles. If there's a relationship of trust, and it was not only my being trustful of them, even my wife, because she told them that, look, I have been part of your team. I have seen you guys doing transplants, and just because it's happened to very dear friend of yours and my husband, I can't blame you for that. So I don't think at any point of time, and Seema, my thing was very, very clear. Okay, that's been my attitude. All of us come onto, I use the word terra firma, right, onto Earth with an expiry date, like a drug. Expiry, of course, pun intended. And we come with a purpose, a mission that the universe gives and says, this is your role to play. I thought to myself that I shall remain here till such time that the universe has got a role to play for me. And that's the end of the story. Okay? At no point of time, I don't think I ever cried. My wife never cried. My friends cried. they'd get upset. And then I used to joke and say, look, I'm not yet dead, man. You keep your tears. If that happens, you cry. But, let's face it. And, the third transplant worked beautifully. It, just like that, it sort of worked. The first 3-4 days, I was passing 25 liters of urine. And one thing that I still carry a lot of guilt in me, every time they used to do the investigations, okay, the nurse would come running to my room and say, your creatinine is coming down, your creatinine is coming down. On the third day, I did a very, very bad thing. I called up the lab and got the report. And when this girl came to me so excited, I told her I already know it. I can never, even today, forgive myself for that. I just cannot forgive myself for that. I could have lied to her, I could have said, oh, is it really so, so nice and all that stuff. But no, that was the concern that they had for me, uh, during the second transplant when there was a leak and they opened me up 3 times in 8 days, and each time I needed blood. And all my Rotarian friends, all O positive. So I used to text Gurmeet, okay, and 3 bottles of blood, and 3 of my Rotarian friends would come and donate, and their blood, the very one used to be kept for 24 hours, and their blood thing. So I refer to them as my blood relatives, because they gave it to me, and 2 or 3 of them insist that I'm a much, much better human being because of their blood in me. Okay, but yeah, I'm a lucky guy actually, if you really look at it. I outlived the surgeon who did my second transplant. The poor guy died of advanced renal cell carcinoma. A couple of other surgeons who looked after me. One of them sadly has got severe dementia and doesn't know what's happening to him. So I think I'm lucky, in a way. And at the end of the third transplant, when my nephrologist said, sorry, but you cannot continue your profession as a surgeon. For a guy who, I decided at the age of 3 to be a surgeon, not a doctor, surgeon, to just switch off. I just switched off. I didn't enter the OR. I haven't held a knife since then. I joke, no butter knife, no vegetable cutting knife, and no surgical knife. And then I, because of my involvement with palliative care and the same, that I think really gave me an opportunity to get busy with something. And I do sometimes feel a little bad because my wife is an anesthetist. She comes back and tells me, oh, this was a very interesting case. Oh, robotics is that. Sometimes I feel, hey, you know what, I could have been probably doing that. But the time that I spent with all of you, including you, has made it really very, very satisfying. And therefore, again, I feel that that's the role that the universe wants me to play. And so I think if you accept what is coming your way, things could have been better, but things could have been worse. I think your way of coping would be much easier, and I think your distress, if at all, would be much less. I was never spiritually distressed. I never challenged God, or whatever it was, and in my interest in spirituality and palliative care and other things all happened because during my second transplant, which was held done in Chennai, and we were there for 1 month. So my wife used to read a lot of books and talk about things, and so that kind of, because I was never was and never am, not really am, a very ritualistic person, unlike my wife, she's spiritual but also very ritualistic. Even today, I've not taken, and even during the worst of times, my wife did believe that there's no conditional worship. You know, I want this to happen, then I will do this, that, or I would make my son, go to Tirupati and shave his head if I get well. But I have done things because my friends have asked me to do. I've gone with a very dear Hindu friend of mine to Velankani because his father used to believe and he used to believe. I went with him. Before my third transplant, is already overdue. So he said, boss, you're going for the third transplant. Let's settle our dues, Infant Jesus will be pissed off with us, Why is he not come? A very clear, dear friend of my wife, classmate. Before I fell sick, much before I fell sick, had a dream, and he made my wife perform a Mrityunjaya Homa, okay, which again is Kamyartha Puja, as they say, But my wife did it because her friend wanted it to be done, or do this. Or some friend said, go to Guruvayur and, Tulabharam, give this, But on my own or on my wife's things, never did a puja asking for a favor from God, or conditional. You do this and then I will do this in return, which I think is stupid, actually. You can't be bribing God for all the things. So that's been a very, very powerful journey. Lots of people have been part of that journey. It's not only I who have, quote unquote, suffered, my children, my parents. And I'm happy before my parents died, I was well for 2-3 years. So, they knew that I was well. So, that I think is the long and short of it. Yeah.
So one last question, sir. So how has your spirituality or your changed as a in all this, the process?
If you were to go with the opinions of my close friends, some of them very close friends, one of them said, what's wrong with you? I said, why? What happened? He says, bloody fellow, I've never seen you, earlier asking, is that all right? Do you think it's a good idea to do it? Part of my communication skills. But I have now reached a stage of enormous inner contentment and peace. In spite of the fact that I, gave up surgical practice or surgery, because that was what I wanted to do ever since I was 3 years old. But I think working in palliative care and also my MSc thesis was on spiritual concerns because I felt that is one area which gave me a lot of support and solace, but there are people who may need that support and solace because of the fact that they're not able to understand or factor in or process their problems. And that's how I got, interested and drawn. Of course, I read a couple of very good books by Krishna Pukhalski and the others. And I was very lucky to get a very good mentor, Dr. Santosh Chaturvedi of Nemans and his colleague Prabha Chandra. And coming to the hospice and, working with you people, many people, of course, much younger than I am, gives me a sort of a high, so to say. And, I love coming over here. I love going around and, doing a lot of teaching. We're doing a lot of work on end-of-life care. So I think my second innings probably have been better than my first. Overall, I think I'm very fortunate. So that I think is the long and short of it.
Thank you so much, sir. I think the one thing that we will take away is, retaining your faith in times of crisis, and probably learn to develop a sense of humor like you do. I think these are the two takeaways I think that we can carry forward for anybody who is in crisis. I think the learning points that we all need. Correct?
Yes, I agree with you. Thank you.
Thank you. Thank you
Thank
so
you very
much,
much.
sir.
Thank you.